Hey nurses, welcome to another video. During my nursing program, I felt so difficult to learn pharmacology. All we were trying to remember somehow its name of the drugs, its actions, its side effects, and so on. So I just want to help you today to remember calcium channel blockers very fast. So let's take a word from calcium, that is calm, that makes us remember fast. Calcium channel blockers are negative inotropic, negative chronotropic, negative dromotropic. So let's forget all these confusing terms. I just want to say inotropic is related to contraction, chronotropic is related to heart rate, and dromotropic is related to rate of conduction through AV nodes. Now let's check what happens in positive dromotropic. They are cardiac stimulants, strengthen, speed up, make it work harder. So in negative dromotropic, they are cardiac depression, slow down and depress the heart. And what do they treat? Remember 3 alphabet, that is triple A. Antihypertensives, they are anti-anginals, anti-atrial arrhythmia. Antihypertensive relax your heart and blood vessels. Anti-anginals relax the heart, so it uses less oxygen, which is decreasing demand for oxygen. Anti-atrial arrhythmias treats anything atrial, not ventricular, like atrial fibrillation, atrial flutter, paroxysmal atrial tachycardia. Do they treat supraventricular tachycardia? Yes. How? Supra means above the ventricle, and that is atrial. Side effects are hypotension and headache due to vasodilation. Always measure blood pressure due to risk for hypotension. Names of calcium channel blockers are end with dipin, example amlodipine, nicardipine, nifedipine, estradiol, nisoldipine, and 2 others. Those are verapamil and cardicin. Cardicin can be given continuous IV, not if systolic BP is less than 90 mm of Hg. Slow and titrate the drip to keep systolic BP greater than 100 mm of Hg.